healthcare. This is why I think your program is so exciting, Nora, but trying to bring people to be able to understand how you actually scale things within healthcare is genuinely challenging. And I think that globally, we need to start working a little bit more on how we help people. And we don't just continue to have the usual suspects being able to innovate, but that we have, like a million small unicorns rather than one or two, if that makes sense. So my last, I'll finish because I'm nearly at time, Nora, so I'll hand back over. But I'll just mention that I really do believe that the digital transformation can help. Not, when you talked, I think it was the sixth point you made in your opening address, you said a lot of people don't have access to wearables, to the technologies that we take for granted. However, what we're finding in low and middle income countries, and I was just speaking with GSMA this morning about this, is that once people get hold of a mobile device that's connected to the internet and they can afford the internet and they can use that device, then the world unlocks. Then they can begin to access the healthcare that they need. They can begin to access the education that they need. They can begin to access the other elements of life that I don't think should be separated from healthcare. The reason I think we're all getting increasing incidences of mental health and why it's such a burden on society is in part because we are segmenting health from the other elements of life, which really actually make us healthy. So making sure that we enable people to have that basic access, I think will unlock things for people. Thank you.
Great, thank you so much, Kathy. That was really thought-provoking. Now I want to turn to Sam Shaw. Sam is the Chief Medical Officer at Newman, an organization that actually was created and is focused on healthcare for men. He is particularly passionate for digital healthcare solutions and really helping create access, not just for men, but the greater population, particularly around healthcare that fits into lifestyles. So Sam, I'll let you say a little more about yourself as well as present your thoughts on this topic.
Well, Professor Colton, thank you so much for inviting me. And it was great to hear the reflections earlier on from both Catherine and Chris. Much of what I'll say hopefully will touch on points that both of them have already made. By way of background, I'm a clinician. I've worked in digital health probably the best part of sort of 10 years and in technology for perhaps about 15 to 20 years. So it's great to be able to talk about what could be the future, not only of technology, but also of healthcare. But just to take us back slightly, the concept of wearables in healthcare is certainly not new. It's been around for quite some years now. And it's almost synonymous with the Internet of Things. The boom of the Internet almost has equally sort of been the boom of wearables in life and in healthcare. And the first question that I always go back to is the why question. Why bother? And what's the aim? What's the outcome that we're looking for? So I always go back to the public health concept of health inequalities and accessibility of healthcare. And certainly from my perspective as a consultant in public health, is that healthcare is certainly not equal for all in many ways. If we take health systems around the world, and Chris touched on this earlier, health systems are themselves complex. The UK health system, the NHS in its various iterations is a good example of a complex system, but it's not unique. Every healthcare system around the world has its own degree of complexity, whether that's the number of interactions, the multiple layers, the bureaucracy, or even complexities such as the volume of staff that we're dealing with. Take England, we have 1.3 million workers in our healthcare system alone, and 33,000 organizations that make up the NHS just in England, delivering healthcare to the population, made up of hospitals, ambulance services, GPs, dentists, pharmacies, and many, many more, all transacting data about people and people who are patients. But the world has changed. We now have 5 billion unique mobile users around the world, 4 billion people that can access the internet, and 3.5 billion people, many of us probably here, who are social media users. So it gives us some indication of what could the potential role of wearables be in the future, and more so its acceptability to the population as a whole. And if we think about digital capability, it's changing. Certainly about 3 years ago, we used to think of there being a 12% digitally disengaged population just in the UK. Around the world, that varied. Digital penetration varies around the world. The United Arab Emirates is the most digitally penetrated country in the world at 99%. The UK is sitting at about 94%. The US is around 95%. And this is changing around the world. Digital penetration is certainly increasing. However, there are still inequalities. There are pockets of populations around the world that do not have equal access to digital capability, whether that's the internet, devices, computing power, whichever it happens to be. So it's important to go back to the fundamental, which is resolving, fixing inequalities in access to healthcare, experience in healthcare, and quality of healthcare by perhaps using technology. So wearable sensors, where do we get to? Well, they're already impacting on healthcare, whether it's medicine, whether it happens to be monitoring, whether it happens to be services within a clinic or outside of a healthcare setting. We've got devices that are revolutionizing biomedicine through mobile use, through digital health, and that could be continuous and longitudinal health monitoring, both inside and outside of a clinic setting. But wearables also can be facilitating the development of algorithmic medicine, using autonomous and automated health event prediction. And we've seen some of this in certain settings in the UK, but also globally. And certainly during the pandemic, we've seen a lot more of this being used. But new wearables are, often there are analytical-based platforms that are used side by side alongside wearables. And the difficulty is getting these into the real-world setting. And some of these have expanded at an unprecedented rate in the last year. But often we see some of the barriers in complex and legacy health systems, and what do we do with them? We've got everything from the use of wearables to trigger ICU alarms, all the way through to use in people's own settings, in resource-limited or rural settings, that we certainly need to think about when we consider the use of wearables. And wearables may be non-implantable devices filled with sensors. And the sensors classically are segmented into 3 categories. We have mechanical sensors, we have physiological sensors, and biochemical sensors. There are 3 types of sensors that are classically used in wearables. And these might range from consumer grade through to research grade devices. And the data from these have wide applications, but of course, a big challenge is getting the data into a useful format and one that doesn't burden clinicians or the health system. So in healthcare, the application of wearables goes much further than we might have in other settings. It's for the prevention of deaths and for improving patient outcomes. And we often see these, whether it's patient monitoring, whether it's IoT hubs, or whether it happens to be diagnostic support tools that can be used and deployed in ambulances or other settings. And even ingestible sensors arguably are a dimension of wearables now as we go into the future of healthcare. So wearable devices offer us this opportunity, but that opportunity only becomes a reality if we can ingest that voluminous data and do something useful with it. And that could be the new evolution of algorithms. It could be the application of machine learning in a different form, or it could be, dare I say, even the application of AI using some of that data and combining it back with those wearables. But perhaps that's one for the future. So something we need to think about is how do we integrate this data in a meaningful way, integrate it into an EHR to make it useful not only to the citizen, but also to the clinician. Some use cases for wearables have been in metabolic and cardiovascular health, gastrointestinal health, sleep, neurology, mental health, maternal, both pre and neonatal care, and pulmonary health and environmental exposures. These are all different use cases of wearables in healthcare. But there's a problem. What about the regulatory oversight? Because of course, this varies in every single part of the world. Even between the UK and mainland Europe, it's now diverging. Between the US and Europe, Between the Asia Pacific region, in each country it varies. So the regulatory model has to be resolved in some way to make the use of wearables beneficial in a healthcare setting, especially if we think about medical grade wearables. Globally, the regulations vary, and that puts a burden on very small innovators, which maybe global device manufacturers might be able to overcome, but certainly for small entrants that might be fixing small niche problems, those that affect a minority in the population, much more difficult. And when we combine this technology with medicines and with other types of technology, what is the technology and how does it get classified? Because this is another barrier, especially when it comes to reimbursement. Then we've got issues such as privacy, civil liberties, and dealing with the big unknown of cybersecurity in the future, especially when we think about automation. Where does cyber come into this, and how do we make sure that people are protected when they're using wearables that may trigger a response? And then finally, the thing that we don't talk about is some of the challenges. What about 5G infrastructure? Is it good enough yet? And will it be good enough to support wearables? The access to the data, who has access? And then sensoritis. Are there going to be so many sensors that we are all overloaded and experience a form of sensoritis, and how we manage for this? So wearable sensors have an extremely broad application across healthcare and medicine as a whole, whether that's acute chronic monitoring or overall management of healthcare, both inside and outside of the clinic setting. But it does require us to do a number of things. Sort out the funding, the regulatory model, address some of the issues around data, resolve digital inequalities, and also think about the wider impact on health services from sensoritis and clinician burnout. But hopefully we can have a bit more of a discussion as we go through, but thank you.
Great, thank you so much, Sam. That was really helpful, and I think raised a number of questions as well as provided some answers. So now I go to our final panelist today, and that is Gloria Cosoli. She joins us from Italy. She's at the University Politecnica in Delamarche in Italy. She's in the Department of Industrial Engineering. Her research, she is a researcher, is in really non-invasive measurements, systems and techniques. And she's written a very timely article on wearables. So over to you, Gloria, and happy to have you say a little more about yourself as well.
Thank you, Nora, for your kind introduction and invitation, and for having organized this interesting webinar. I will share my screen. I hope you can see it. There, so thank you. So my talk will be focused on wearable devices, especially on their metrological aspects and performance, so the measurement accuracy, precision, and so on. At first, a little introduction of myself. I am graduated with a bachelor degree in biomedical engineering and a master's degree in electronic engineering. Then I got my PhD in industrial engineering and became a postdoc research fellow in industrial engineering. At present, I'm also an adjunct professor of mechanical and thermal measurements at eCampus University. My research interests includes, among the other, non-invasive measurement systems and techniques for different application sectors, such as construction, mechanics, and obviously also biomedics, the development of virtual sensors, the support of sensors, signal processing techniques, and especially wearable devices with a particular focus on their metrological characterization and their use combined with artificial intelligence algorithms and machine learning techniques. In this slide, you can see briefly my scientific production on wearable devices. These are some of my scientific articles published in different journals and related to the application of wearable devices in the healthcare-related sectors. My co-authors and I have also stressed the importance and the support provided by wearables during the COVID-19 related pandemic, and also the importance of the measurement accuracy in the use of the output of these devices. Similarly, in this slide, there are some conference proceedings on wearable-related topics. For example, in the Healthy IoT conference, which is taking place online these days, we are presenting a prototype of wearable device that we have developed in our laboratory. It includes a photoplethysmographic sensor for the measurement of heart rate and also a load cell for the measurement of the contact pressure between the skin and the band, which obviously influence the output of the device and so the data quality. Nowadays, the application of wearable devices relates to many fields of the healthcare sector. We can mention, for example, ambient assisted living, the so-called AAL, remote monitoring of patients, allowing the medical personnel to control the vital parameters of patients, reducing the number of outpatient visits, and thus optimizing the patient management, and shortening also the time required for a consult. Among the other contexts, we can mention rehabilitation, the support to elderly people, sleep monitoring, sports medicine, cardiology, and also the early detection of viral symptoms, for example, in the case of COVID-19. All these applications are directed towards an improvement of the people's quality of life, but we can also have false positive alerts, which are obviously related to the measurement accuracy of these devices. Today, an increasing number of citizens are wearing a wearable device, such as a smartwatch, and often many of us bring the provided information to the doctor appointments, and this also helps us in being more engaged with our own health. Indeed, we don't consider these devices as invasive, since we perceive them very similar to a common watch. They are user-friendly, relatively easy to use, and also relatively inexpensive. All these factors have contributed to a wide spreading of these devices all over the world. On the other hand, very few people wonder about the measurement accuracy of the data provided by wearable devices, as well as the reliability and quality of the data we gather through them. Moreover, the manufacturers only rarely provide information on the test procedures followed to characterize these devices from a metrological point of view. And furthermore, they do not give proper information, proper indications on the wearing conditions which enable to maximize the data quality. The market competitiveness in the wearable device world is increasing, also opening different market segments and satisfying diverse typologies of customers. But only few of the wearable devices are classified as medical devices, for example, according to the FDA clearance rule or the Council Directive 93/42 EC on medical devices. From a scientific point of view, only little literature is available on the validation procedures followed to characterize these devices, and also the available studies provide non-homogeneous data, which are barely comparable among different studies because of different test samples, different test protocols, and also different evaluation metrics are adopted. Therefore, we would need a standardized test protocol for validating these devices, and so being able to collect comparable data among different studies. Since many of us wear a smartwatch or other kinds of wearable devices, for example, a smart ring or also different types of smart clothes 24 hours a day, it is easy to understand that they are a very big source of data which can be used for artificial intelligence applications. that are very helpful for classification purposes, for example, in the field of the identification of viral symptoms, such as in the case of COVID-19, but also in very different backgrounds, such as emotion recognition, stress assessment, affective computing, and so on. However, no clear legislation exists on the issues related to privacy and security of the data gathered by these wearable devices. We can state that the potential of wearable devices is huge, for example, for remote monitoring of patients and personalized care, and also for sharing data from remote. A combined use of wearable devices and artificial intelligence algorithms can support decision-making processes, so supporting the whole healthcare system. But we can state without doubt that there is still need of a lot of research to improve the standardization aspects related to the validation of these devices and for their characterization from a metrological point of view. Indeed, only in this way we can have reliable data and high quality information from the use of wearable devices. So we should underline that it's very important to reach standard validation procedures for wearable devices through the comparison with reference instrumentation, such as an electrocardiogram for the measurement of heart rate, and so on. The metrological characterization, moreover, should consider standard metrics such as measurement accuracy and measurement precision, as defined in international guidelines, for example, the GAM, that is the Guide to the Expression of Uncertainty in Measurement. Moreover, we should properly consider also the interfering factors which can modify the results. Among the others, we can surely mention the environmental and also the wearing conditions. So we can definitely define a standardized test protocol for the validation of this device, and we have also to establish metrological characteristics to be defined according to standardized metrics. Only in this way we can obtain a good measurement accuracy, which can provide us reliable information for wearable devices, which can be potentially useful for our health, avoiding also anxiety linked to false positive alerts from this device. To conclude, a short thanks to my colleagues involved in the research of wearable devices from my university, Università Politecnica delle Marche, and also from another Italian university, Università degli Studi di Palermo. So thank you all for your attention, and if you were interested in deepening some of the topics I have introduced, please contact me. Thank you.
Thank you, Gloria. And I think if we could just stop sharing the slides.
Yes. Okay.
All right, great. Thank you. Okay, well, that really excellent presentations and thought-provoking. And I think what I've seen, so just to get us started here with some of the discussion, because I also see it coming up on the feed, is really that there are a couple areas that all of you highlighted. So I'd like to really provoke you a bit. And one of them is around the data concerns. And I think that really fits into two areas. One is, of course, around data protection. But the second one really is around the quality of data. And you know, how important that is, particularly when we're talking about health. And so, and then that spills, of course, over into this whole regulatory area. So we've got lots of products out there, and as Sam said, with lots of sensors, and you know, I'm just trying to imagine my future with all these implants, and then, you know, Sam has to frighten me by mentioning cybersecurity. You know, so how do we make sure that we're collecting data, but we're doing it in a very secure way that helps create a better future. And you know, how do we get everybody to start playing together? Because it is, you know, if I listen to all of you, it seems to me you've described a real Wild West where, you know, for as many health systems we have, we've got, you know, lots of different variations about how to go forward in this space. So who'd like to, you know, take that question on?
Happy to get started on it. So I think we should separate out the three things around security, data privacy and protection, and then the quality of data. And I'll start off with the quality part of this first. And it ultimately comes down to what the need is. What are we using a particular sensor device for? And what's the outcome? And not just the outcome now, but the outcome we're looking for in the future. And the challenge, of course, is whether or not we're aiming to try and use some data for diagnostic purposes. And if that is the case, then of course the quality has to be the best that it can possibly be for diagnostic value. But it might not be the case. It might be we're using it in a way that isn't designed or ever was deemed to be for diagnostic use, in which case there might be a different grade of data that we accept. But the moment that we're expecting clinicians to use it, and if that is our end game in order to help somebody make a better decision, then of course we need to make sure that the data is of clinical quality and hopefully diagnostic quality. And that will require a certain quality of device, sensor, and potentially even using computing power that might be on people's own devices, like a mobile phone, to transact that data. But of course, all this comes at a cost. So that's the first area. And we do need to do better at creating devices of the right grade to produce the right quality of data. The second thing, though, is around privacy and protection. And everyone gets very worried about this, as do I. But I think this comes back to having some transparency over what data is collected, who is processing it, and how it's going to be used. And I think at every stage we need to be transparent about this, because that's not always the case in our existing health system or in the world of wearables. And in fact, people are probably transacting data all the time that is health data that will be no different to perhaps what they might transact from a wearable. But it's just about the openness of where that data is going, how it will be used, and who's going to process it. And as long as we're clear about those things, then people can make informed choices, and hopefully they are informed. And finally, on security, I, like everyone, probably gets worried about security. But here's the thing. The risk to security only comes out of really the quantum and the value to somebody that perhaps shouldn't be interfering in a pathway of transacting on data. So if we were in the US, where that data had value to an insurer, value to a payer, and disrupting that flow of data could perhaps be of value to someone that might be interested in a ransom, then of course there might be some greater need for security. Take a place like the UK, in a publicly funded, dominated system where the value is much lower, the sort of constraints of security might potentially be lower. So I think it's really important for it to be proportionate, pragmatic, but at the same time continue to protect the individual.
Thank you, Sam. So I just want to follow up on that, and if I can get someone else to come in here. So one of the questions in the chat is, should wearable technology devices for consumers that detects, and this gets to what Sam just mentioned, but detect heart rate, oxygen saturations, and other vitals, be allowed to come to market without properly validated study? And we know that there are those kinds of wearables out on the market. Does this not mislead the population into a false sense of security? Who'd like to try this question?
I can give it a go. Give it a go.
Oh, great.
I think it comes back to what Sam says, and it depends what you want the device to do, right? I mean, I have great fun in any new Fitbit testing it to get it wrong. You know, I had great fun in knowing that if you walk along the street eating a packet of crisps, it double counts. Brilliant, right? You know, that's a very good thing. And as a computer scientist, I love, you know, finding the problems in the algorithms. But what do you really want? And I think what we found in our studies, it's interesting, Chris, that you've been given a Fitbit, because what we found over and over again in the actual usability and the behavior change side of using these types of technologies is that they have a sort of a high impact early on. And that's generally to relatively tell you what you're doing, right? So I would almost argue it almost doesn't matter if the algorithm's a bit wrong and it's 1,000 steps one way or the other, provided it's consistent. If it's consistently wrong, then for you as a person, you'll get to know that was roughly 7,000 steps. If I take the stairs, it's, you know, it's a bit longer. That's good. You'll begin to build those healthier habits into your life, hopefully, and that's a good thing. But then often people give up wearing it anyway, or they give up recognizing it or caring about it anyway. And so I think I would be more interested as a researcher in making sure the data is consistent and that it's usable by the person to make healthier decisions, and I'm making it or helping them to use it for longer and get deeper insights than I am necessarily about whether it's exactly correct.
Okay, well, just to kind of a follow-up on that, and again, it comes out of our really some great discussion questions, by the way. So thanks to everyone who's put some questions in there. And that's about the challenge around user compliance. So it's great to put these out, but we're all kind of assuming something about the people that are going to have these. And you know, we know for a fact, if we look at the stats on medication, you know, compliance is a huge issue, right? People after about 2-3 months, they start self-medicating, they start changing the way they do their doses, they take themselves down, they take themselves up. So how much can we actually rely on this? And then are we creating, again, this kind of, the question is a data overload, you know, this kind of false sense of security about people's health, because we've, you know, as Chris has, you know, everyone in the country's got to watch. Does that mean that the population, Chris, is safer? Or what is the assumption there? How are they using? That's a lot of data.
Yeah, I'll answer the question, and I kind of wanted to tag on to what Catherine was saying previously too. It's interesting here, they did start doing some, because if you imagine if everybody has a Fitbit, right? You don't have to do a statistically significant sample study. You can actually do a true population health study, right? And it was interesting here because they did try to monitor, you know, the effect of giving people a tracker, and does it actually at least maintain it when I encourage their activity. And it was a complete ramp down. You know, it was an initial spike and then a complete ramp down unless you were to pay people or some other kind of artificial way to encourage them. So that was interesting. The other interesting aspect, and then I want to make one more point, because I mentioned earlier I've had a lot of failures in B2C in this space, is that so the Singapore health system is pretty much offline. It's been hacked multiple times. The computers in the hospitals aren't even on the internet. You know, we've gone backwards. You know, and there's been so many discussions here about putting it on the cloud and just all the gains that you'll have out of that, right? And so Google was sort of unsuccessful in basically convincing the Singapore government to move to the cloud. But of course, the government then later decided to roll out Fitbits to everybody. And of course, later then Google acquires Fitbit, right? So it's just kind of funny how these whole spaces evolve. But earlier when I said I've had some bad B2C failures, one of the main reasons was because of just the way users interact with the technology, right? And this is where I think sometimes we throw around terms like patient centricity, when in reality, that's not always the most appropriate model for particular lines of care. And I can give you 2 examples. We tried to launch a respiratory wearable, monitor for COPD and asthma. We tried to launch it B2C first while we were pursuing the regulated channels. And in the end, you know, the outcomes were quite poor, and it became hard to convince the payers because of the way the users were trying to interact with it versus it going through like a prescription channel, right? Or the other one I had some experience in was trying to roll out cardiovascular monitoring, heart health monitoring for people who were deemed high risk or post-surgery. And once again, they were not using it properly, and they were getting false indicators of danger, and then therefore causing all kinds of chaos in the system, right? So I just think sometimes patient centricity is actually not always the right model, at least until levels of literacy are achieved. The only thing I would say here is, you know, when we're trying to work with the early stage innovation companies on their scale up plan, Catherine talked earlier about kind of scalability and sustainability, you know, we are trying to make sure that they do go down the regulated route, not just the quick gains of a B2C model always, right? So here's where we're trying to get out of randomized control trials and do more real-time evidence generation models with governments and things. But I would say this is a big influence I'm trying to push, is not just have every wearable tech company just go down the kind of easy route, but, you know, healthcare is regulated for a reason, right? So anyway, that's my thoughts there.
All right, thank you so much, Chris. So I see we're out of time, so I just want to take one more question, and I see it's been put in by one of our colleagues in India, and he's asked it twice. So Gloria, you get to answer this question, and he's asking really how wearable technology can help in neurosurgery or spinal care. Have you come across any examples of that, and do you see that as part of the bigger frontier going forward?
So thank you for the question. I think that wearable technologies can be usable and useful in very different application fields. Also in neurosurgery and spinal care, we can think, for example, to smart glasses, taking measuring signals relating to the electrocardiography, to the brain activity. I think that possible application in neurosurgery are in these sectors more than a smartwatch. We can have smart glasses taking care of what is happening in the brain. But obviously, it is always important to take into account the measurement accuracy. And so we have to be sure that what we are measuring is effectively what is happened in the human body. Otherwise, we can take wrong decision, and in healthcare and in diagnostics, especially, we can't do these errors. So I think that we can use wearable devices, many different application fields, but different application fields require different measurement accuracy. So it's important to differentiate among the application, and it is important to make consumers aware of what they are using, of the type and the quality segment of the device they are using.
Okay, thank you so much. Really wonderful panel. Does anyone have any final comments they'd like to make? Well, I just want to say it's been really informative, and I've enjoyed it tremendously. I've learned a ton, and I hope everyone else has as well. We have another webinar coming up in January. It'll be about universal health coverage and the finances of that coverage. And so I hope you'll join us then. We've got, again, an international panel of experts who will be speaking and addressing this topic. So I think it'll be equally as important, timely, and I look forward to seeing all of you again. Thank you, and thank you to our panel. Take care. Bye.